I'm just going to go over really quickly the basics of adrenergic drugs because I think it's honestly really important to understand like the background and the basics before you like dive in deeper to like understanding the drugs, because pharmacology really isn't just about memorizing, it's about understanding how the drug works. So I'm going to just go over a few vocab words that you're going to have to know for like the rest of your life if you're a nurse or any other medical profession. If you're doing pharmacology, you're going to need to know these. And personally, I think that I'm going to give you some helpful hints into how to remember these things. And hopefully you won't just memorize them, you will understand them. So here we go. So adrenergic drugs, I think of ad, so the prefix is ad. I think of this because it's adding effects onto the sympathetic nervous system. So your sympathetic nervous system is your fight or flight response, right? So you're basically running from a bear, and your sympathetic nervous system picks up. So your adrenergic drugs mimic the sympathetic nervous system, okay? So next we're going to talk about vocab. So inotropic is really important to know. Inotropic is the contraction of the heart muscle, okay? And chronotropic is heart rate. So the way I remember this is that I remember chronological, and chronological means in order, right? So I usually think of numbers, and so the chronotropic is the heart rate. So that's how I think of it. If you have a different way of thinking of it, please tell me so that we can help more people in the understanding of pharmacology. And then the next one is dromotropic, which means the electrical conductivity of the heart. And this one I remember by like a drone. It sounds similar to a drone, and a drone is like something, I don't know, it just reminds me of electrical conduction. So if it doesn't help you, fine, you don't have to, listen, but I just wanted to put that out there. And then now we're going to go over the receptors in the adrenergic system. So these, you're going to have to know these to understand how the medicines work, because the medicines act on these receptors. So first we're going to talk about alpha-1 receptors. So alpha-1 receptors cause vasoconstriction, all right, meaning your arteries and vessels are getting smaller. They're constricting. And it increases BP, which makes sense, right? Because if your arteries and veins are getting smaller, then you're going to have an increase of blood pressure. It decreases nasal congestion. So you probably heard of pseudoephedrine. We're going to talk about that in the next video, but pseudoephedrine is a drug that, Sudafed, you probably heard of that. It like vasoconstricts the vessels in your nasal mucosa, and so that's how it helps with nasal congestion. And then it contracts the GI and GU sphincters, and that's really important sometimes. And then also one big thing is it increases glucose. So in patients with diabetes, it's really important to like watch them closely when they have an alpha-1 drug. Okay, so beta receptors. Beta-2, I'm going to start talking about beta-2 because it's my favorite. So beta-2 receptors are receptors that basically, if you think about running away from a bear, that's what your beta-2 receptors are. So let's go over that a little bit more. So bronchodilation, your airways are opening up, right? So if you're running away from a bear, okay, what would you want to happen? Would you want your lungs to constrict so you couldn't breathe? No, of course not, right? So you want them to open up, right? And vasodilation, you need the blood pumping really fast, really well. And, you get more blood pumping to the skeletal muscles, the brain, the heart, when you have vasodilation. It also decreases the insulin. because a lot of times the way I think of it is that you need energy when you are running, when you are, doing whatever, when you are scared, and honestly, well, so insulin, I don't know if you know this, but insulin decreases glucose. So if there's decrease of insulin secretion, that automatically means that the blood glucose is going to be higher. So that is another way to think about that, is that, like, you need energy and you need energy to be running away from that bear, if you want to use that example. And then relaxation of the smooth muscles, so like the uterus, the stomach, the bladder. The beta-2 receptors also facilitate this. Okay, so the last one we're going to talk about in the video is beta-1 receptors. So beta-1 receptors, remember the vocab we talked about like a few seconds ago? Okay, so remember that adrenergic, we're adding things on, right? So remember that it's always positive. So positive inotropic is the myocardial contraction, right? And if you have a positive inotropic effect, then it means that you're going to increase the myocardial contraction of your heart, which increases cardiac output, etc. And then you're going to go on to chronotropic, which is also positive because adrenergic, you're adding it on. So positive chronotropic, which would mean increase in your heart rate. And then dromotropic is electrical conductivity, meaning you are going to have increased electrical conductivity, which in like return will help help with your blood vessels and your just get blood pumping. So that's about it for right now. If you have any questions, let me know. Thanks so much for watching, and I hope it's helpful.